Dear friends, in this episode of Planet ED, let's discuss this new published systematic review on impact of normocapnia versus mild hypercapnia on the prognosis after the cardiac arrest. So let's dive into this study. So the objective of this study was to look at the impact of mild hypocapnia versus normocapnia on the prognosis of patients after the ROSC following cardiac arrest. So this was the methods of this study. It was a systematic review and a meta-analysis that search for all the major databases, and that was a quite extensive duration and number of studies that they followed the data of the studies from early 2000s till this latest 2024, and they looked at the studies that involved the post-cardiac arrest patients with mild hypocapnia. So what was the definition of mild hypercapnia, normocapnia used in this study? So this mild hypercapnia was used at this PCO2 levels of 46 to 55, and this normocapnia was usual 35 to 45. Now, what were the study outcomes? The study outcomes they looked in this study were, first was the overall mortality of these patients, and second was this favorable neurological prognosis. So these were the two major outcomes that the study looked at, and this is what they found. So there were a total of 6 studies. As usual that we see, there are not many studies related to emergency medicine, so 6 studies, 4 observational and 2 RCTs. Well enough. Now the number of patients were quite good. It was total 9,000 patients data that they looked at, nearly 7,000 that received this mild hypocapnia, whereas nearly 2,000 patients received this normocapnia. So you can say the ratio of 3:2. More patients received the mild hypercapnia, the data with, and 1/3 of the patients out of this 9,000 had some normocapnia. Now, so total 3 kinds of studies were there. Out of these 6 studies, 3 studies they looked only at this out of hospital cardiac arrest patients. So one study looked at the in-hospital, and one more study that looked at the combined in-hospital and out-of-hospital patients in these studies. So the results that they found that compared to normocapnia, there was no significant difference. There was no significant difference in overall mortality among patients with mild hypercapnia. You can see the p-value is insignificant. Odds ratio, that's insignificant as well. And proportion of patients with favorable neurological prognosis was again not altered. No much difference of those with favorable neurological prognosis, whether you keep them on normocapnia or on mild hypocapnia. Again, this odds ratio and this p-value, it's quite insignificant. So when they looked at the overall ICU mortality rate, that also was not significantly different. That also was not quite significant between the 2 groups. So again, the ORs, confidence intervals, and p-value doesn't really a big change. So the subgroup analysis showed that the results of these RCTs and observational studies were quite consistent. So this is what they see. So in conclusion, this meta-analysis of 9,000 patients, this found no difference in your overall mortality, no difference in ICU survival, and no difference at the neurological prognosis. So in these patients with mild hypercapnia or normocapnia in this post-arrest patients. So what's the strength and caveats? I would say that there was a good sample size as far as the EM patients are concerned, and there was no statistical significance, no difference in subgroup analysis for either of this normocapnia versus mild hypocapnia. There was a mixed patient setting, that patients were from both out-of-hospital cardiac arrest and in-hospital cardiac arrest management. So this is a kind of a mixed type of the patient population. And another caveat that this is more observational studies. As you can see that 4 of them are observational studies and 2 of. So again, that kind of a caveat when it comes to doing a meta-analysis and pooling studies. RCTs are preferred, and they are of more value if they are randomized and blinded. Observational studies, we are seeing that more papers in meta-analysis of observational studies are coming, but again, observational studies have their own limitations, like they are not much validated, or there's a risk of high risk of bias among these studies. But in this study we see that we are not finding any difference on combined results. That's the thing, that we are not having any such result that we really dig down more into this. So ultimately we didn't find any difference. So bottom line is that aim for normal or mildly hypercapnia in post-ROSC patient with cardiac arrest. That's the go with. Thank you.